to make this of Nairobi kwa sababu Nairobi si yako. Is it? So this is part 2 of the series about my career, medical laboratory science and technology in Nairobi in Kenya. So I got a few questions that I thought I should make a video because you guys asked, and I would like to help someone out here so they don't struggle like I did. So the first question was about salaries. That I will not be able to comment on that, but guys, just do your research. If you get shortlisted for this company, you can find out from someone who already works there how much they earn, then you can bargain around that, because in these companies almost everyone gets their own salary. So you can't tell you that you can't hii place utalipo hivi, if you go to this place you get paid like this. But when you go to these big hospitals, you mention like around 100k, then you bargain from there, atakupatia kitu. Hata ikifika 20k, mean it's your bargaining power. When you go to these small hospitals, this is so sad, they pay around 25,000. But guys, no, there's a place I went to immediately after school, though they never paid me. They were paying people 25,000. When out there I was like, I took a 60,000. And imagine, the guy was like, fine, but he never paid me too. So yeah, you just have a bargaining power. Yeah, so just know your worth, guys. Umesoma vitu mingi shule sana, so you need to get paid, you need to pay your bills. So yeah, that's it for the salaries. Then the other question that I'll be answering is about, and before I mention that, I'm sorry I did not mention, we also have medical laboratory science in Maseno. I'm so sorry I did not mention that. I was just rambling, I forgot to mention. So yeah, another thing I would like to talk about is internship, the importance of internships and attachments and how to get them. And this knowledge is based purely on what I think, on what I have gone through, and my research. So if you have a different experience, you're free to comment down here. So attachment, it is very important that you go for attachment when you're doing this course. So every time you go for a long holiday, do not go home, just look for a place to do attachments. You know, for some campuses like ours, it was not compulsory to go for attachment, but then we used to go for attachment because if it's either I go for attachment and stay in Nairobi or go home and stay in Ushago. So I chose to go for attachment rather than stay home and do nothing. So yeah, I went for attachment. In first year I went to Mwingi level 4, that is at home. My mom got me the attachment. Then in second year I went to Mama Lucy Kibaki Hospital. I got the attachment for myself, and I tell you how. And then in third year I went to pathologist Lancet Kenya, and I got the attachment for myself, and I'll tell you how. And in fourth year, instead of going for an internship, I got a job at AR Healthcare, and that is where I did my internship. I was doing locums there, learning, but then I had enough knowledge to work. So the importance of attachment is, one, for some companies, if you don't have experience, you can use this attachment as your experience. Like when you get out here, like I know you guys can relate. Every employer wants years of experience, but where are you going to get years of experience immediately after school? The attachments. So you apply for the job. If you are shortlisted for an interview, then they're like, how many years of experiences do you have? You calculate your attachment. I mean, you are working, and on top of that, working for no pay. So yeah, the second advantage of going for attachment is the knowledge. So the practical knowledge is very important in this career. So when you go for attachment and you get to deal with real people, real patient samples, you become really good at your work, like I am. I'm proud to say that. And if you don't go for attachment, you'll be rambling, you'll not be knowing what is going on. Like whatever you read in school might be very different from what you get out here. So when you get out here without any experience and you get a job, you will struggle, guys. You will struggle, and struggling at work is not something anyone wants. So yeah, those are the two main important points about attachment. So how do you get attachment? To get attachment, you need to have the will, the determination, and the patience. So what I used to do to get an attachment was, the first thing I would do is I go to the dean at school. Then I would ask for a letter that would allow me to go for attachment. The letter would indicate to whom it might concern. This student is a second year student in the University of Nairobi. They want to be attached to your hospital. Please give them a chance. It's like the dean is asking the HR or the people at the hospital to give you a chance to practice. So after you get that paper, you make many copies, then you keep the original copy. After you make the copies, Then sit down and list the hospitals or the institutions you want to go to. Just list them. Then go to those hospitals and ask to see the lab manager. Go, guys, see kubaya, but when you go to the HR or the front office and you ask to drop your CV over there, it will never be seen by anyone. So what I used to do is I would print my CV and that letter for attachment from the dean. Then I would carry it to the hospital. When I get to the hospital, guys, be confident about everything. If you are shy and timid, guys, this life is not for you. You need to be confident about some things. So I would go to the manager's place, to the lab. Then I'll be like, I want to see the lab manager. Then the person who is there would be like, do you know the lab manager? No, but I have been sent to the lab manager. I'd like to see the lab manager. So you see the lab manager and make sure you dress well, official. So when you go to see the lab manager, they will see, like we say, they know what they are doing here. So you'd be like, I am so and so, I am a second year, a first year, third year student, and I would like to be attached in your hospital. Here's my CV and the letter from my dean. Please, if you can consider doing that for me, I'll be very happy. Then some managers will be like, okay, when do you want to start? Others will be like, no, there's no chance. Others will be like, okay, I'll call you if there's a chance. Whatever answer you get, don't give up. You just walk around with your CV and your letter until you get an attachment. Yeah, so that is how you get an attachment. So short stories about how I got my attachment. So in first year, like I mentioned, I went to Mwingi level 4 hospital, and it's so hard to get an attachment as a first year because I'm just one to Mingi and people are very skeptical about you handling the samples. But my mom was working there in Mingi level 4 hospital. So she talked to the manager and I got the attachment. Yeah, and my work was really good, so they did not regret getting me. So if you get an attachment through connection, usiende hapo kuchoma. Next time you won't get one if you want. Hata kama kazi hawatakuitia. And then when you work so nice, they will even call you for locums and start earning pure attachments. Then in second year to Mama Lucy Hospital, I printed papers. I dropped them in every institution in this Nairobi, and I was not called. The only institution that replied me was Mama Lucy, and I used to live on the other side of Nairobi, but I used to wake up every day and I go to Mama Lucy for my attachment, and I learned so much because it's a public hospital. There are a lot of samples, and you know, if you want to learn and experience different things, then you need to go to a public hospital. Private ones will not be allowed to do some things, but in public ones they will be like, students wako hapo, acha afanye kazi. And that is how that is the place that I learned a lot of things from Lucy. Then for Lancet, I was like, okay, I always want to go to Lancet. Let me go drop this at Lancet. So when I was going to Lancet, I was going to drop my papers at Lancet. Then they were like, okay, this is not the office, need to go to Mombasa Road. And I was at the which office? I was dressed nice, but they looked serious and official. So they were like, it was Upper Hill. I was in Upper Hill, and then I was directed to go to Mombasa Road. But when I was leaving, I met someone. Then they were like, hi, what are you looking for? Okay, my name is Veronica, and also professional with it. My name is Veronica and I'm looking for an attachment, but unfortunately I have been told to take my papers to Mombasa Road, but it's fine, I will take, thanks for the concern. Then the person was like, okay, you're so kind, let me see your papers. When do you want to start? I want to start my attachment on Monday, and on Monday I came back, I started my attachment, and I also learned a lot from Lancet. You know, if you are in my field, I was in Lancet when Lancet was Lancet. Right now Lancet is still Lancet, but then there was no competition. Yeah, that is where I did my attachment, and I think having that letter from Lancet has gotten me jobs. And then when I went there, I worked really hard. When I was leaving, the manager was happy. I got good recommendation letters. So yeah, now ukipata attachment, if you get an attachment, please, it's so hard to get an attachment. You know, people, they refuse you to work for free. So imagine getting a job. So you work hard. Another thing, you can hook up your friends. I mean, when I went to these places, God knows, I hooked up my friends. I was like, I have a friend, she's looking for an attachment. Can she come? Then it's easier to get your friend an attachment when you're there than when you're outside. And that is how I got an attachment, and I got my friend's attachment. And so yeah, that's it for attachment. And If you have another question, you can just comment down here. I'll be happy to answer, guys. I want you guys to grow in this career. I want you guys to be proud of you, who you are. When I was finishing school, I was kind of not very proud of what I did in school. But right now, guys, I'm so proud of what I did because it feeds me and this is who I am. So yeah, so let's make the future bright for our career. Let's continue working hard, and I hope you guys succeed in whatever you're doing. If you have a question, just leave it down here. Remember to like, subscribe, leave a comment down here. Let's get to 2,000 subscribers.